In the UK and across the world, the current standard of practice for venipuncture cannulation is to use a tourniquet. Once you've applied the tourniquet, you need to then palpate the vein or visualise it. Tourniquets have some limitations in clinical practice. If they're left on for too long, they can cause bruising or hematomas. If they're on too tight, they can cause damage to the tissue or underlying structures of the arm. Some patients have got very frail skin and that can become broken with the tourniquet. So in some patients there are some limitations.
Well, there's often been quite a few problems with my veins, and when I've had to have cannulas put in before, sometimes the member of staff's had to leave the tourniquet on for longer. It's been uncomfortable, and I have to be honest and say that sometimes they haven't always been able to access my veins at the first attempt, so obviously it can sometimes be a little bit traumatic.
I see patients every day who really struggle with vascular access. They go through multiple cannulation or venipuncture attempts. It's really distressing for them, and it's one of their biggest anxieties before they come into hospital. It's not uncommon for some patients to come back multiple times having had unsuccessful venipuncture and cannulation.
I'm a specialist nurse for vascular access, and we get referrals from the wards for difficult access. For example, access for bloods, access for cannulation. And we get roughly about 8 to 10 patients a day across the hospital.
Practitioners have had problems with my veins in the past because my veins are very small and they have to use a yellow needle, which is a child's needle, but even then it's hard to find them.
People struggle with venipuncture and cannulation for multiple reasons. Vascular access can be a struggle with patients who have had cancer and chemotherapy, or who have very deep veins, or veins that are very small even with a tourniquet.
There are particular patients that are very difficult for venous access, like the very old, quite elderly, the very young, high BMI patients, and also the very dark skin patients.
There's a massive requirement for change in the way that we do things with vascular access, particularly for the peripheral lines and peripheral blood taking. If we could find a solution to help patients who have real problems with vascular access, that would make such a difference to the patient, because it would reduce the amount of times they'd have to undergo a painful procedure.
It's painful if you have to do it several times, and it can make you feel a bit shaky, or sometimes people faint, so that is difficult.
What's really exciting is there is a device called Veinplicity, which uses a biophasic waveform which increases vessel size, so when you palpate the vein it feels larger, firmer and easier to cannulate or take blood.